The virus nobody is talking about. Imagine surviving a global pandemic, only to discover another deadly virus was quietly waiting in abandoned buildings, empty cabins, and the dust inside forgotten rooms. COVID-19 changed the world forever. Millions infected, cities locked down, entire countries frozen in fear. But while the world focused on coronavirus, another virus stayed hidden in the shadows. A virus carried by rats. A virus that can destroy the lungs within days. A virus with a death rate far higher than COVID-19 in severe cases. This is Hantavirus. And the terrifying part? Most people have never even heard of it. Unlike coronavirus, Hantavirus doesn't spread through crowded airports or packed streets. In many cases, all it takes is breathing contaminated air inside a poorly ventilated room. An old storage building, a cabin, a basement, a forgotten attic. That's all. The virus is mainly spread through infected rodent urine, saliva, and droppings. When these particles dry out, they can enter the air, and once inhaled, the infection begins. Symptoms may not appear for weeks. At first, it feels harmless. Fever, headache, muscle pain, nausea, almost like the flu. But then things change fast. Victims can suddenly develop severe breathing problems as fluid begins filling the lungs. Blood pressure crashes, oxygen levels drop, and in the worst cases, patients can die within 24 hours after severe symptoms begin. That's one reason experts take hantavirus seriously, even though outbreaks remain rare. Now compare that to COVID-19. Coronavirus spread faster than almost any virus in modern history because it moved easily between people. A cough, a crowded room, a handshake. That was enough. Hantavirus works differently. It spreads slower, but in some cases it can be far deadlier. And that raises a disturbing question. What happens if a virus like hantavirus ever evolves to spread more efficiently between humans? Right now, person-to-person transmission is considered extremely rare and has mainly been linked to the Andes strain in South America. But after COVID-19, many people no longer trust the phrase low risk. Because we've heard it before. Before lockdowns, before overflowing hospitals, before the world stopped. That's why some scientists continue monitoring hantavirus closely. Not because it's the next pandemic, but because history has shown how quickly the world can underestimate emerging diseases. Still, there's an important difference. Unlike COVID-19, hantavirus is much easier to avoid if proper precautions are taken. Experts recommend avoiding contact with rodents, ventilating closed spaces, wearing gloves during cleanup, and never sweeping rodent droppings dry. Because one invisible mistake can sometimes become a deadly one. At the moment, there's no widely approved vaccine for most hantavirus strains, and treatment mainly focuses on intensive supportive care. The good news? Most outbreaks remain small and localized. But the fear surrounding hantavirus comes from one simple fact. It reminds people that dangerous viruses never really disappear. Sometimes they're just waiting quietly, in places nobody thinks to look.